All right, welcome back to Pharmacology. Today we're going to be going over Narcan, also known as naloxone. The class for Narcan, it is a opioid antagonist, and as a quick review, antagonists, they're designed to inhibit or counteract the effects of drugs or the the undesired effects caused by those drugs. This Narcan works by competing with the narcotic receptors. Opioids have a much higher affinity, therefore depressing the central nervous system, causing significant respiratory depression. Moving in here to how it's supplied. You can see over here on the left, this vial here, this is a 0.4 milligram per milliliter, having a total of 10 milliliters. So if we were to give the entire vial, this would be a 4 milligram vial here total. Over here on the right, these are pre-filled. This is a pre-filled syringe. This one here is a different concentration. This is 1 milligram per milliliter. And there are 2 milliliters in here, so we have a total of 2 milligrams that is inside the pre-filled syringe total. This is one of the most common forms that we receive in EMS. If you'll notice here in this picture, this already has a mucosal atomization device, also known as the MAD device. This does not come with the package. This will have to be supplied separately. You can see here, here's a few more examples of how it could be supplied to you. This vial here, this is a 1 milliliter single dose. With a concentration of 0.4 milligrams per milliliter. So this entire vial here is only 0.4 milligrams. Over here, Narcan has gotten so common to be used, it can now be found in many of your drugstores over the counter without a prescription. So you may see it in this upper right picture here as these nasal sprays, or even this one here on the bottom. Many police departments are now carrying these, and it depends on what the manufacturer. This one here is a total of 4 milligrams. So these do come in different concentrations. You can see here the key. They have the key here as a reference to show you how big these are. You can see these are relatively small. People are now carrying these in their homes. Many of the police departments carry it, and it's very readily available just right over the counter. So moving into our indications, why do we want to use this? This is for a narcotic overdose with the respiratory depression. That's really the key factor here, is the respiratory depression. If you have an overdose that is breathing with a normal rate, rhythm, and quality, you may or may not, depending on your local protocols, give Narcan. Really, we're really wanting just to reverse the respiratory depression effects. Just to be clear, many people will call just about any illicit drug a narcotic. What we are talking about here are opioid-based medications, and these are just a few examples here of morphine, fentanyl, methadone, oxycodone. There's many in here that comes in many different forms. You'll see it injected. It's in a powder. It's in pill forms. So it can be found in many different forms. Another indication would be just simply altered mental status of unknown cause. If we've already ruled out things like stroke, hypoglycemia, hypoxia, if your local protocols would allow, this would be a completely appropriate drug to administer for altered mental status. If we've already ruled out everything else. One of the very nice things about Narcan, as far as the EMS world goes, there is really no contraindications for us, none at all, outside of a known hypersensitivity, and I've personally never come across that. So it's a very safe drug, and that's why it can be found over the counter. Police are now carrying it. Because there's very little side effects and contraindications to Narcan. Our adult dose, so this will depend on the literature you read. You'll see some literature that says up to a maximum of 2 milligrams. Some are a maximum of 4 milligrams. This drug can be repeated per protocols. Some protocols may repeat every 5 minutes. Some are every 10 minutes. So this will really depend on your local protocols. But what I have written here is a pretty standard for your normal run-of-the-mill overdose. So your minimum dose would be 0.4 milligrams, usually up to about 4 milligrams. Now, in the past 2 or 3 years, there's been a great increase in carfentanil, and what that is a morphine or heroin rather laced with fentanyl, which makes it several hundreds times more potent than either one on its own, causing a lot of overdose and deaths. So it would not be it would not be uncommon to see a specific protocol for a known carfentanil to even start out at maybe an initial dose of 4, or maybe an initial dose all the way up to 10 milligrams. As far as pediatric goes, this is a safe drug to give to pediatrics, although you will have to follow your local protocols for that. Our contraindication here as far as pediatric goes, if we had a known a mother giving birth, and we knew the mother was highly addicted to an opiate-based drug, if she goes into labor, the infant, the newborn, will also be addicted. We would absolutely not want to give a newborn Narcan. They need to just protect their airway, take them to the preferably a hospital with NICU capabilities. That infant is going to have to be weaned off very slowly. If we were to give Narcan to them, that could absolutely be detrimental. Moving on to the route of administration. This is a very safe drug. We can give this in just about any form. We can give it here in IM, intramuscular, IV. Of course, any drug that we give with IV is also safe to give IO. This can be given subcutaneous and also in intranasal. Just remember, if we're pushing an IV or IO, we want to give it slowly, so we don't have a sudden withdrawal and with violent behavior. The onset, this will really be dependent on the dose, how much you give them, but usually it's a very quick-acting drug. It's usually around a minute, maybe even less, depending on what the route you're giving it and how the dose you're giving it in. The duration or the half-life, again, that's going to be dependent upon the dose, but it's usually somewhere around 30 to 60 minutes. So it's a very safe drug, works very quickly, reversing that respiratory depression, and it lasts for a little while. So it's a very good drug for EMS. Some of the special considerations as far as pregnancy goes, this is a Category B. Category B, as a reminder, means that it has been tested in animals and not been proven to cause any detrimental effects to the fetus. To my knowledge, there's been no studies in humans in the first trimester. Although third trimester it has been tested, and there has been no untoward effects toward the child, or the fetus rather. Category B simply means that the the benefits outweigh the risks, and is considered to be generally safe. Something to remember here: many of your opioid drugs, such as morphine, can cause hypotension. Narcan will not reverse the hypotension, only the respiratory effects. So you may follow your local protocols as far as reversing hypotension, probably with fluids or possibly Benadryl. Remember, I spoke earlier about giving this as a slow IV push. given too rapidly, this may precipitate very violent behavior. You're taking someone with heavy withdrawals, pulling them right out of it. This can cause tachycardia, maybe some dysrhythmias, and very violent behavior, nausea, vomiting. So we want to make sure we give this rather slow. We are really looking to just have them sleepy but breathing. That's really what we're after. We don't really want these people fully awake. We want to keep them breathing and just get them transported to the hospital. I believe that's going to about wrap up Narcan. If you guys have any questions, always feel free to reach out to me. And I think that'll wrap it up today.